Hello and welcome to the Six on Seniors live web chat. I'm Ruth Teets, Director of Marketing at Baptist Health. I'm filling in for Tim Bartos, who will be back next Monday. And I'm thrilled to have as my live web chat guest today, Dr. Victor Shingo Jr. from Fox and Shingo Plastic Surgery in Schenectady. And I met Dr. Shingo a few years ago for some non-cosmetic plastic surgery and was very impressed by what he does over there. And I was thrilled that he decided to be a guest today. So I'm going to tell you a little bit more about him. He's been practicing plastic surgery in the Capital District since the summer of 2000, a graduate of New York Medical College, where he was awarded membership in the prestigious Alpha Omega Alpha National Medical Honor Society and received the New York Medical College Trustee Scholarship for Academic Excellence. Wow. He has been interested in plastic surgery, and that came about when he was going to medical school, where he also met his lovely wife, who is a native of the Capital District. So after completing medical school, he completed a 5-year general surgery residency at the University of Rochester, and ultimately went on to complete his plastic surgery training at the University of California in San Francisco. Not a bad place to be. He developed a very strong interest in cosmetic plastic surgery and sought additional focused training at New York University and the Manhattan Eye, Ear, and Throat Hospital. And he is the only plastic surgeon in the area to have completed a 1-year fellowship in cosmetic surgery. So after he did all of that, he and his family relocated to the Capital District in 2000, and your wife is an OBGYN here locally.
Yep.
Okay, so you are board certified in plastic surgery and general surgery and a member of the American Society of Plastic Surgery and the American College of Surgeons. You enjoy all aspects of plastic surgery with special interests in breast and body surgery, as well as facial cosmetic surgery, which I know we all want to know more about, especially rhinoplasty, nasal surgery. And you operate at all 3 of the campuses of Ellis, as well as your own office operating room suite. And you consult at Sunnyview. You're busy. In your free time, you enjoy spending time with your family, and you are a marathoner. So, wow, thank you for taking time out of your busy schedule to be here today. We're going to be talking about cosmetic plastic surgery procedures and how popular they are among the boomer population. We were talking about that a little bit, and you know, we're all living longer, and that's good. We want to live good, healthy lives, and we want to look good. So tell me a little bit more about who your typical patient is seeking out these kinds of services.
Well, it depends on, you know, what services particularly you're talking about. I mean, when we're talking about the baby boomer population, for example, there's at least an 18-year gap between the youngest and the oldest boomers. So the boomers that are on the older side might be looking for something more towards facial rejuvenation, whether it's non-invasive or more invasive procedures. Whereas the younger boomers, you know, late 40s, mid to late 40s, might be more interested in body and breast procedures potentially. So it really just depends on which age group you're talking about, and then we can focus in on specific procedures that are popular depending on age.
So let's talk about the big one. I had a lot of my friends, I was asking them, what do you want to know about? Folks want to know about Botox and dermal fillers. You know, we've all seen the advertisements, and we all know folks that have done it. What do we need to know?
Well, I can tell you that in the last decade, there's been really a huge increase in popularity of minimally invasive procedures, and at the forefront is Botox and the dermal fillers. Botox has been around for a lot longer than people realize. It's celebrating its 10th anniversary of being approved by the FDA for cosmetic indications, but it's been FDA approved actually since 1989 for medical uses around the eyes, for treating eye muscle disorders and eye spasms. So it's been around a long time, and we used it for a long time for cosmetic indications before its official FDA approval. We use it as an off-label wrinkle treatment methodology. And what you need to know about Botox is that it's a way of mitigating the signs of facial aging with minimal or no downtime and virtually no risk. That's the most important thing. The other issue is that it's something you'd have to repeat. And the average patient does it about every every 4 months. But the product itself its effect wears off, and so you have to repeat the treatment. It's really replaced, Botox has really replaced a lot of the surgical procedures that we used to do for brow rejuvenation. Brow lifts were a lot more common a decade ago, and now we chemically rejuvenate the brow with Botox. You can get, not only can you alleviate wrinkles between the eyebrows and in the corners of the eye, but you can lift the brow a little bit with Botox. So it works as an agent that will lift the brow, and it will enhance cosmetic results from an upper eyelid procedure, for example, without a lot of extra surgery.